everybody, we're from Royal Life Saving Society Northumberland and Durham branch. This is Perry and South Shields Volunteer Lifeguard Club, and we're going to talk to you about CPR.
Hello, my name is Pamela and I'm going to take you through the Save an Adult's Life workshop, which looks at CPR on adult casualties for part of some first aid training. So here we go, we'll get started. So the aims of the workshop today are to look at the causes that can stop somebody from breathing or lose consciousness, to learn how to check if a casualty is breathing normally, what to do when a casualty isn't breathing normally, so CPR, which stands for cardiopulmonary resuscitation, and what to do when someone is choking. We're also going to have a look at what to do when a casualty has been drowning, because we have to do something very slightly different. What can cause a person to stop breathing or lose consciousness? Well, there's a few things. So first of all would be a heart attack. So that's obviously where somebody's heart starts to have problems pumping and circulating blood around the body, and this can cause them to stop breathing and lose consciousness. Drowning, obviously taking water into the lungs, or sometimes it can happen where you enter cold water and you get cold shock and your airway closes, and that can stop getting air into the lungs. Choking, obviously something being an obstruction in the airway is going to cause somebody to stop breathing. That could be either a minor obstruction or a full obstruction of the airway. And other medical conditions and injuries, they can vary, and it just depends on what the person is suffering with, but there's lots of different things that can cause breathing to stop and a person to lose consciousness. If we came across a person who was lying on the floor and appears to be unconscious, as in the picture here, we've got a mannequin. What we need to do first of all is to check for danger. Now, checking for danger means we have to look for anything that's going to hurt them or us and make sure it's safe to approach them. So for instance, if the person's been inside of a building and they may have been near electrics, we need to make sure there's no electricity around them, and if there is, make sure it's isolated before we approach them. There could be debris around the person, we have to make sure that's cleared away to make sure it's safe before we get there, and just remove any danger if we can. The next thing we need to do is check for a response. So you're going to take both hands on the adult's shoulders and we're going to give them a little shake and we're going to ask them a question. We're going to say, "Are you all right?" And we're hoping to get a response and that the person's going to wake up. If we don't get a response, we're going to check for normal breathing. So to do this, as the lady's doing in the photograph, you need to put one hand on the head of your casualty, 2 fingers under the chin, and you're going to tip the head back and tilt the chin up. And you're going to put your ear down next to the mouth and the nose, and you're going to have your elbow nice and high, and you're going to look down the chest. And we're going to look, listen, and feel for any breath coming out of the mouth. So we're going to listen for it, we're going to feel for it on our cheeks, and we're going to look to see if the chest is rising up and down when we look down the chest. We want to do this for up to 10 seconds. So that's what we need to be looking for. Now, when we're checking for normal breathing, what we mean by normal breathing is breathing that we're doing now. So how we are breathing now is normal. If it didn't sound like normal breathing, then we need, and it sounds sort of gaspy or noisy, that definitely isn't normal. We need to call 999, ask for an ambulance and ask for an AED. Now, an AED is what we call an automated external defibrillator, and that is a machine that is used to put on somebody's chest, and it'll shock the heart and hopefully get it beating in a regular rhythm again. So there are our initial checks to start with. Check for danger, check for a response asking, "Are you all right?" Check for normal breathing for up to 10 seconds, head tilt, chin lift, and we're going to look, listen and feel down the chest. And then we're going to call 999 if there's no normal breathing, ask for an AED. So what I'd like you to do now is, if you can get a teddy bear or a pillow, if if you can have a little go of that with me. So I've got my teddy bear here. So I'm going to come into my area. I found my person collapsed on the floor. First of all, I'm going to make sure it's safe to approach them. So I'm just going to move these out of the way here from the desk. And then I'm going to tap the shoulders and I'm going to ask them, are you all right? Are you all right? There's no response, so I'm going to check for breathing. So I'm going to put a hand on the head, 2 fingers under the chin, and I'm going to tip the head back, and I'm going to get down and listen, look, and feel. So I'm listening for breathing, I'm feeling for breathing, and I'm watching to see if the chest is rising and falling for up to 10 seconds. There's no normal breathing there, so I'm going to take my phone and I'm going to dial 999. There is another number we can use, which is 112, and I'm going to call and ask the operator for an ambulance and ask for an AED. So if you want to have a little go of that, you can. We're going to have a little watch through the video. You can do it as the video plays if you like.
Are you alright? Can you call me an ambulance and tell them I've got an unconscious adult who's not breathing, I'm about to start CPR, and come back with a defib?
Okay.
So we've been through our initial checks. Check for danger, check for response, check for normal breathing, and call an ambulance, 999, and ask for an AED. We're now going to look at what you would do after that. So we're going to, first of all, if obviously we haven't got any breathing that's normal, we've called an ambulance, it's on its way. So now we are going to do 30 chest compressions. All right. So what we need to do, just like the lady in the first photograph there, is you need to take one hand, put your other hand on top, right? And then you're going to come up on your knees, the side of your casualty, and you're going to have straight arms locked at the elbow, and you're going to push down from your shoulders straight down the chest. And we're going to push down about 5 to 6 centimetres. We're aiming to do 30 compressions at about 100 to 120 per minute. So it's not very slow, but it's not super fast because you don't want to tire yourself out. And then we're going to do 2 rescue breaths. Now, just like we did the airway check before, we checked for breathing, we're going to do that again. We're going to put one hand on the head and 2 fingers under the chin, and we're going to tip the head back and lift the chin up. We're then going to pinch the nose, and we're going to breathe into the mouth twice. All right, so just the breath for about a second from yourself into them, okay, and then just breathe and then breathe. Then we're going to do a further 30 chest compressions. So again, you're going to get yourself in a position at the side of the casualty, put one hand on top of the other in the middle of the chest on the breastbone. So that's that bone that runs down the middle of your chest. And you are going to lock your hands, come up on your knees, elbows locked, and push down from your shoulders about 5 to 6 centimetres 30 times. And then you're going to keep alternating between rescue breaths, which is 2 breaths, and the 30 compressions until help arrives. So if an AED arrives while this is going on, because there's a lot of them in the local community now, you can find them on the sides of public buildings, airports have them, railway stations have them. I know our local town hall has one, and there's one on the coast near where I live, where you can access a code and you can get an AED out. You turn the machine on, and then you follow the voice prompts, and let's follow what I have to do. So essentially it'll tell you to take the pads out, put them on the chest following the pictures, and then plug it into the machine. The machine will only work if it has to, so you can't do anything wrong with it. Okay. Then what we're going to do is we're going to watch the video so you can get your teddy bears again, and you can go through this with the video and have a go at doing some CPR on your pillow or your teddy bear.
Can you call me an ambulance and tell them I've got an unconscious adult who's not breathing, I'm about to start CPR, and come back with a defib?
Okay.
So just to run through what we've done just there, we've done 30 chest compressions, so 2 hands, one on top of the other, in the middle of the chest, arms straight, locked at the elbows and pushing down from the shoulders. We've done that 30 times, a depth of about 5 to 6 centimetres on the casualty's chest, and we're doing it at about 100 to 120 compressions a minute if we did it continuously. After 30 compressions, we're going to do 2 rescue breaths, and we do that by tipping the head back, lifting the chin up, pinching the nose and breathing into the mouth, and we give 2 breaths. Then we're going to continue doing 30 compressions followed by 2 breaths, and if an AED arrives, we're going to turn it on and follow the voice prompts. So you can have a go at that on your teddy bears and your pillows and keep practicing that. And then what we're going to do now is we're going to put everything together. So we're going to have a look at the complete sequence of CPR.
Are you alright? Can you call me an ambulance and tell them I've got an unconscious adult who's not breathing, I'm about to start CPR, and come back with a defib?
Okay.
We're going to get our teddy bears and we're going to go through from the top. So we're going to check for danger, make sure the area is safe. Check for response, asking, are you all right? Check for normal breathing, so 2 fingers under the chin, hand on the head tilt, chin lift, and we're going to get down and listen, look and feel for up to 10 seconds. And if there's no normal breathing, we're going to call 999 and ask for an AED or a defib as it's sometimes known. Once we know the call's being made for help, we're going to do 30 chest compressions. So 2 hands in the middle of the chest, arms straight, straight down from your shoulders, push down 30 times, about 5 to 6 centimetres on the casualty's chest. We want to do about 100 to 120 a minute at the speed. That's what we need. Then we're going to do 2 rescue breaths. So again, we're going to do head tilt, chin lift, pinch the nose, and we're going to breathe into the casualty's mouth. Then we're going to continue compressions followed by 2 rescue breaths until help arrives or an AED arrives and we turn it on and follow the prompts. Now we're going to look at choking. And choking is an obstruction of the airway that's often caused by food. I mean, I know I've suffered from having something go down the wrong way. So, and it's not very nice, but there are 2 types of airway obstruction that we can have. And we can have a mild airway obstruction, where air can still get past, but there is something definitely stuck. And there is a severe airway obstruction where the airway is completely blocked and nothing can get past it, no air at all. So when we're talking about choking and how we assess what kind of choking people have, we've got this little flow chart. So a mild airway obstruction, we assess the severity, and if it's mild, well, they've probably got an effective cough, so we can encourage them to cough to clear the obstruction that's in the airway. And we need to continue to check for any deterioration or until the blockage is relieved. So just keep asking them to cough and see if it can relieve itself.
Keep coughing, keep coughing, keep coughing, keep coughing. Oh, hold on.
So that was a mild obstruction, we've just seen the video, and now we're going to have a look at a severe obstruction. So again, to assess the severity, a severe obstruction, and hopefully they might become conscious, so they're going to have an ineffective cough. So if you ask them to cough it up, it's not going to budge. So what we need to do, I'm just going to pick my teddy bear up for this, is we need to support the casualty under the arms, and we're going to give them up to 5 back blows. So you're going to use the heel of your hand and we're going to give them a blow between the shoulder blades on the back, and we're going to check them out to see if anything's come out. So we're going to do that up to 5 times. If it comes out after the first back blow, obviously we're not going to give them 2, 3, 4, 5. If that hasn't worked, we're going to give them up to 5 abdominal thrusts. Now, an abdominal thrust is where you take a fist and you put it above the belly button but below the rib cage, and you come from behind the casualty and you put your other hand on top, and it's an inward and upward movement. So we're going to do up to 5 of those, inward and upward, and see if it comes out. If that doesn't work, we then go back to the back blows. So you can do another 5 and another 5 abdominal thrusts. Just keep repeating. If the person does become unconscious, then we need to lie them down carefully, and we need to go through CPR that we've just done previously in this workshop.
Are you choking?
Let's go back and just look through the flow chart. So if we've got somebody who's choking, we need to assess the severity. So if it's a mild obstruction and they can have an effective cough, we're going to encourage them to keep coughing to clear the blockage. And if they do deteriorate, then we can have a look at going on to a severe obstruction. If they've got an ineffective cough, we can give them up to 5 back blows with the heel of your hand in the middle of the back. Make sure you support them at the front. We're going to give them up to 5 abdominal thrusts as well. So remember, that's making a fist. We're coming around the casualty's tummy, so above the belly button, below the ribs, and it's an inward and upward movement. And what that does is it pushes any air in the diaphragm up and hopefully dislodges whatever is blocking the airway. And you just keep repeating that while they're conscious until the obstruction is cleared. And if the obstruction doesn't clear, then we need to lie them down carefully and start CPR. So moving on, we're going to have a little look at drowning now. And in RLSS UK, we do a lot of work with drowning. We train all the lifeguards in the country, beach, pool and open water. We run the National Lifeguard Qualification Awards. And drowning is a problem because still there's 300 to 400 people a year in the UK drown. And that number's still too high. And we're working hard on drowning prevention to try and lower those numbers. So more than 80% of the drownings occur at open water sites such as rivers, reservoirs, canals, beaches, etc. And some of these sites, like beaches in the summer, do have lifeguards, but a lot of the time in the winter and other inland sites such as rivers and reservoirs don't have lifeguards, and that's where people get into trouble, and especially because the water is cold. And it's not just cold in the winter, it's cold all year round, and this dramatically reduces your ability to swim. So if your muscles are cold, it tires you down and you can't control what they're doing and you can't swim properly, and that's sometimes what we call cold water shock, and that can affect people, and it does amount to people drowning, unfortunately. Drownings occur in all age groups and are particularly high in males aged 15 years and older, and 1/4 of all adults who drown have consumed alcohol before drowning, unfortunately. Babies, children and the infirm can drown in water as little as 4 to 5 centimetres in depth. So it's just enough water to cover the mouth and nose. So we do have to keep an eye on children, especially around water, because sometimes, especially little babies, they can't keep their head up by themselves, which is why obviously they should never be left alone in the bath. If we did happen to have somebody who suffered a drowning, obviously we need to try and remove the casualty from the water as soon as we can, and then we need, just as we did before with a casualty, check for a response and asking, are you all right? And then we're going to use the CPR sequence that we went through before to treat them. So if you can remember that, what that is, check for dangers, check for response. We're going to open the airway, check for breathing, and we want to hear normal breathing. If we don't, and they're not breathing normally, then we need to call 999 and ask for an ambulance and an AED, and we need to start doing our 30 compressions and 2 rescue breaths until help arrives. If anybody has got any questions, then they can get in touch with us through Girl Guiding in Newcastle. but I hope you've enjoyed this workshop this morning and you've learned something new, and I hope you have a lovely weekend.
Thanks for watching, everybody. Bye.